health, wellness, and you.
Week 4, Emotional Health.
Here's CKDM News Director Matt Hamel.
Hello there, this is Health, Wellness, and You. And on this final week of CKDM's special health and wellness feature, we're talking about emotional health. Today we'll chat with the University of Ottawa's Dr. Simon Hatcher about the cutting edge of mental health resources and how online therapy options are actually proving to be quite effective. Right after this.
Park's Edge Physiotherapy is now open at 420 Main Street North in Dauphin, and they're accepting new patients. Physiotherapy focuses on movement along with active participation to restore, maintain, and maximize strength, physical function, and independence. If you're having problems with any of these, contact them today. And they make it as simple as possible with direct billing to most insurance providers and by offering services to WCB and MPI clients. If you have any questions or would like to book an appointment, contact Park's Edge Physiotherapy at 204-638-9642 or visit them at parksedgephysio.ca.
Today, we're speaking with Professor of Psychiatry at the University of Ottawa, also the Vice Chair of the Department of Psychiatry at Ottawa U, Dr. Simon Hatcher. I read a blog of yours from a few years ago, Dr. Hatcher, that when it comes to mental health, really you've said that there's been pretty few advances over the past 20 years in terms of those mental health resources. Is that still something that you feel at this day and age?
There haven't been many major breakthroughs in mental health over the last 25 years. And the treatments I offer people who I see now are pretty similar to what I was offering 25 years ago. Some things have changed, like using technology to deliver some of that help, and also the ways in which we interact with technology, maybe providing opportunities for doing things slightly differently. But you have to think that 100 years ago there was the Spanish flu, and of course that was a time of rapid technological change then, and I can't help wondering if journalists even then were asking, do you think the telephone or the telegraph will change how you deal with patients who are depressed after the Spanish flu? And a lot of it was around managing the tension between having to isolate but still having to connect with people, by limiting what you can do, but also making sure that you could still be useful to other people, that you did stuff that was helpful to other people. Helping others is one of the most mentally enabling things that you can do.
We mentioned maybe the lack of development in the past 25 years with mental health resources. Can you touch a bit more on where do things need to go? What kind of direction would we like to see mental health resources so they can really make a difference in all the lives of Canadians who are having a tough time right now and pre and post pandemic?
Well, I guess there's two ways. A lot of the effort in the last 25 years has gone into trying to understand how the brain works. That's partly why there hasn't been much progress. We still don't really understand how the brain works. Most complex organism in the body, millions and millions of neurons. We don't really understand how it works. There still needs to be effort in doing that. But what would really help is if people, so that's one thing. The other thing that would help would be people having access to what we know helps. And that's the bit we're not doing very well at the moment, is accessing quality mental health care. It's a very complex, difficult to navigate service, and when you do find your way into the right door, often the service you get isn't particularly great. So one of the things we could do is actually do well what we know works at the moment. And for a lot of people, the coaching through online therapy seems to be reasonably effective. You have to do the program. If you drop out, it's not effective. But if you do the program, these are quite effective, and they do actually seem to increase, again, if used properly, and if people are able to access them, they do seem to be helpful.
Hey, Dr. Hatcher, I really do appreciate your time. You're Professor of Psychiatry at the University of Ottawa. Thank you so much for your time.
No worries, Matt. All right, take care.
If you'd like to hear the full conversation with Dr. Simon Hatcher, make sure to head to 730ckdm.com, go to the Health, Wellness, and You page. I'll be right back, and we'll talk about who we're speaking with tomorrow on Health, Wellness, and You.
Many things have just stopped over the last few months, but there are some things in life that just don't stop for anything.
I was recently diagnosed with lung cancer. The strain on my family has been tough, but if it wasn't for the support of Central Plains Cancer Services and their transportation program, I just don't know where I'd be.
Cancer touches everyone. Your gift provides hope. Your donation stays right here in our region to help our neighbors, family, and friends. Check your mail for your donation card or donate online at centralplainscancerservices.com.
Coming up tomorrow, we'll be speaking with John Vervaeke, a psychologist and cognitive scientist from the University of Toronto, with some helpful suggestions on how we can best manage our mental and emotional health. This is Health, Wellness, and You, a 4-week journey on 730 CKDM, exploring the benefits of balancing our physical, mental, spiritual, and emotional health. In the meantime, make sure to go to 730ckdm.com to listen to all the full-length conversations with the health experts.
CKDM's Health, Wellness, and You feature series is brought to you by Central Plains Cancer Services, Parks Edge Physiotherapy, Dauphin Clinic Pharmacy, Dr. Brenna and Three Graces Medispa, Dauphin Chiropractic Center, Nutter's Everyday Naturals in Dauphin, Parkland Collaborative Legal Options, Fusion Credit Union, and Sunrise Counseling in Dauphin. Listen to CKDM Radio twice daily at 7:15 and 3:15, or listen anytime at 730ckdm.com.